My name is Whitney Meyers. I was diagnosed with a right side ischemic stroke. I woke up early, helped my husband get ready for work, woke up the other kids, started getting them ready, and we were at the point where we were getting ready to get in the car. I must have forgot something upstairs, so I went upstairs, and of course all the kids followed me. Got to the top of the stairs and just felt dizzy and like I needed to lay down. And then I laid down on the floor, kind of laid there for a minute trying to figure out what was going on. And my oldest daughter's name is Taylor. And I said, "Taylor, can you help me up?" She couldn't help me up. So I said, "Taylor and Afton, go over to Allison, who's my sister that lives around the corner, and go and get her and see if she can come and help us this morning." Well, that you could be there for them, I could not.
The girls came on their bike. They said, "Can you take us to school? Our mom fell down and she can't get up." I looked at Taylor and I said, "Is she okay?" And she got tears in her eyes. I thought, something is not right here. I didn't know what exactly was going on yet. Came through the garage, came upstairs, and she was laying flat on the ground, face down. I remember seeing her face, and her face was a little bit droopy on one side when she was talking.
So that when Whitney got here, she was in the process of having this stroke. This blood vessel was occluded, the blood flow wasn't flowing to most of the right side of her brain, and tissue that was supplied by that vessel was slowly dying. But she had a fair amount of tissue in the brain that was still salvageable and in very important locations. The first step is to confirm that you have the stroke, which they did. Within the time frame that's appropriate, as she was, it is appropriate to give this clot-busting medication after you've ruled out that there's no bleeding in the brain, which she did not have. But then the next step for big vessels like she has is to go up inside the vessel itself and use one of the many techniques we have to pull out that clot.
Within like two hours of the stroke's onset, I had the TPA, but I also had the medical thrombectomy, and I was back in the room resting after that happened and healing.
There's a saying in this line of work that time is brain. And so you want to get people to what we call the right place first time, get them there as quickly as possible. In the world of stroke care, as we continue to evolve very rapidly, it's becoming clear that for some patients, it's important to get them to the right hospital the first time. In that case, would be a comprehensive stroke center like the University of Utah.
After you have something life-changing like a stroke, it changes your perspective. So I feel a lot more grateful for my life, for that I can be with my children and take care of my family, my home, and I'm very grateful for the University of Utah. Because of the University of Utah Hospital, I'm alive.